Have you ever had an electric shock of pain go right down your back?
Or felt like pins and needles were attacking your leg?
Stay with us as we go in depth on a condition called sciatica right here on
Everybody Knows.
And welcome to the second season of Everybody Knows. My name is Mike Kasem.
And I'm Catherine Robert, and we're dealing with a common condition today. About 80% of the population will experience lower back pain at some point.
But if you've had pain that starts in your buttocks and then it runs down your legs, stay with us to learn more about sciatica. And if you're a longtime viewer of this amazing show, you might be wondering why we have this table in front of us.
Yeah, I keep looking for my chair to sit down, and there's none. Why are we standing, Mike?
Because our guests today both have issues with their back and they can't sit on a couch for long periods of time.
That is a bad issue to have. Can't sit down.
It sure is, but we're going to learn all about it. And here to talk about the A to Z of this condition, sciatica, we have spine specialist Dr. Colum Nolan. Come on out, doctor.
Hey, Doc.
Hello.
What is this horrible condition, sciatica?
So sciatica, it's not exactly a diagnosis or a condition in itself, but it's basically symptoms that can arise from any condition where you get irritation or inflammation or any injury to the sciatic nerve.
Okay.
And where is the sciatic nerve?
So the sciatic nerve, we can see up on the screen here, actually the largest and thickest nerve in the body. And there's one on the left side, one on the right side. And it's made up from the nerve roots that come out from the spine, and then the nerve roots travel down into the pelvis, and then out into the buttock, and then down the leg. And that's the sciatic nerve. And then at the level of the knee, then the nerve divides up into smaller nerves.
Goes down into the feet?
Yes, it can go all
So
the
then
way.
just a good foot massage and you're good, right?
Not quite.
Not that easy. Let's bring out our guests, because I know they have all sorts of questions running through their heads about sciatica, because they have it.
That's right. And this DJ on Gold 905 rules the airwaves from lunchtime and is in the eateries as your makan kaki.
And this household name in the Indian community is also an Oli 968 DJ who bosses the airways from 4 to 8 p.m. Let's welcome Denise and Sajini.
Hi. Hello.
Welcome to the show. You know, I want to start off by saying I've known you guys for years now. I had no idea you guys had sciatica.
Yeah, we suffer in silence.
Oh, you're so poor thing.
Because I noticed that you guys seem to be walking fine. Is it just in certain positions that are problems? Or?
No, I think at some point the pain becomes part of your life.
Do you guys have the same problem? Or?
Yes, we do.
I think
But
sciatica,
different-
yes.
Yeah, we have the same sciatica pain, but I think different reasons for it.
Yeah, because there are different causes for sciatica, but I'm sure the doctor will be able to tell you better.
Yes. Doc, what's wrong with them? They are the reason we're standing. Are there different types of sciatica?
Sciatica basically refers to pain that typically starts in the back or in the buttock, and then the pain can travel all the way down the leg, even into the foot. It can occur on one side or less commonly on both sides. And the pain can be described as electric type pain, or it can be described as a constant nagging pain. And it can sometimes be associated with altered sensations like, numbness, tingling, and
In the lower extremities? Or?
yeah, so anywhere along the distribution of the pain, people can get these sensations. And then sometimes people can even get weakness in the legs if the problem is more severe. And then very occasionally, in more severe cases again, it can also affect the bowel and bladder functions.
I was going to say, I heard that sciatica can affect bowel and bladder control. What actually causes it?
So thankfully it's quite rare, because we will normally be able to pick up the cases before they get to that stage.
Okay.
But occasionally people can develop injury to the nerves going to the sacrum, which is what control of the bowel and bladder function. So people can actually end up with incontinence.
I think managing it has been super important for us because,
exactly.
You've mentioned the worst case scenarios, incontinence, bowel movement problems, and also if it separates and it affects both legs, that is absolutely not what we want at all.
Yeah.
So I think with this, we can't stand for long, we can't sit for long. So
Can't lie down for long.
Yes, so we've got to be constantly alternating. So if you see me dancing, you know that...
It's pain.
Yeah.
It's pain
Motion
management.
is lotion. That is my catchphrase.
I feel so bad for you guys, really. Okay. It is awful. What causes sciatica?
So there's a number of causes, but the two common causes, the first one would be what's called a slip disc. So I think most people have heard of a slip disc. We can see on the screen here, so this is a diagram of a slip disc. So on the left side here is a cross-section through one of the discs, and the discs are basically the gel or the cushion or like a shock absorber between the bones in the spine. So here on the left we can see what the normal disc looks like. The outer light blue is the lining of the disc, which is called the annulus, so it's like a ring-like structure. And then inside we've got the nucleus, which is more gel-like material. And then sometimes you can see over there on the right side that there's actually a hole in the annulus, and some of the nucleus has herniated out, and then it's pressing on the nerve, which you can see the yellow. And then the red is the inflammation of the nerve that's occurring as a result of the compression. So this would be the most common cause of sciatica.
So how do you check for sciatica? Do you have to wait until you get the pains and then be like, oh, okay, maybe I need to get this checked out, or can you do it beforehand?
Yeah, I mean, most people wouldn't know about anything going on in their spine unless they actually develop symptoms.
Yeah.
So it's really only once people get pain, then they will potentially, they may try to manage it themselves first with simple painkillers, maybe some hot packs, ice packs. They may go for some TCM treatment, but eventually if it becomes more troublesome, then they will go and seek medical attention. And eventually, if we suspect sciatica as a diagnosis and if we think there may be a slip disc or something, then we will order an MRI scan to check, and that will confirm the diagnosis. So on the MRI scan, we can visualize the structures in the spine very clearly. So if we look at the diagram here, so this is actually a model of the spine. So there's different parts to the spine, but this is the lower back area. So there's 5 bones. This is the disc between the 2 bones. So this one here is between bone number 4 and number 5, so L4-5. And you can see here part of the disc has herniated out, and it's pressing on the nerve. So it's this compression of the nerve that causes the sciatic pain and the tingling and the numbness that radiates all the way down the leg. So this is one of the most common causes. And then as people start to age, when the discs start to thin out and when you get bone spurs, when you get aging changes in the joints between the bones, and also the ligaments can overgrow, which we can see here on the diagram, then you can develop a condition called spinal stenosis. And the end result is the same, because you end up with nerve compression, and then that nerve compression can cause the sciatic pain. And then in some cases, the bones, as a result of the degeneration in the spine, in the discs, in the ligaments, in the joints, the bones can actually slip out of place. So then you end up with spondylolisthesis.
Oh, that's yours?
That's mine. I can barely pronounce the condition I have.
Okay.
Spondylolisthesis.
Perfect.
Okay.
Yeah, my L4 and L5 are out of joint, so the one of the vertebrae is actually poking on the nerve.
So you're not talking about O-level results?
No, although if you want my C6 and C7 also not doing so well.
O-level, mine, I had to stand and do my O-levels because that's how much in pain I was.
Oh my gosh.
Yes.
Okay,
So
we're gonna find out more about what you guys had to go through, because it sounds absolutely painful. But it's time for us to take a break. But stay with us, because we're gonna learn more about what kind of lifestyle factors might put you at risk of sciatica right here on Everybody Knows.
Welcome back to Everybody Knows, and today's subject is sciatica, which you might know as the shooting pain that runs from your buttocks, maybe all the way down to your feet even.
Ouch. All right. For Mr. Yo, his active life was disrupted by that very pain. Here's how he dealt with it. Take a look.
Hi, my name is Frankie Yo. I'm 68 years old. I'm suffering from sciatica for some time. Last year, I think it's September, while I was walking, then I feel that my left leg had been numb, So I said, okay, maybe a little while will be gone, And then suddenly there's an electric shock, like a kind of current, like electrocuted, So painful. I went to TCM. They give you some massage where the sciatica is, and then 3 to 5 days later, you come back again. A lot of people say, maybe it's my job. I'm working as a chef for almost 40 years. My job needs a lot of standing. Most of the time, 10 hours maybe. But then it can be also degeneration because of my age, So maybe both. Actually, I'm a very active person, I did a lot of hiking and trekking. You know, every Sunday I will go hiking. I will go to Chestnut there for 4 to 6 hours. So this I can't do anymore because of uneven terrain, you know, so it causes a lot of pain. So I cut down on this, and then I have to find my way, you know, to repair this first. So that is how I go and see a doctor. So my GP said, okay, you refer me to the orthopedic. So when I went to orthopedics, they found out that, you know, my L4, L5 was compressing my nerve. The doctor gave me 3 choices. One is you go through surgery. The other one is you go for injection. Then one more is, you know, you go for physiotherapies. These 3 options. So I also asked the doctor, you know, okay, what is the difference between these 3, you know, yeah? The doctor asked me back, you know, so, okay, what do you want in your life? What do you want to do? So I said, I want to go back to my activities, you know. So he said, you know, since you want to go back to activities, I suggest, you know, you have to go through the operation. The operation will last you, after everything, will last you at least 15 to 20 years. So he said, injection, you can last you maybe half a year, 1 year, then you got to come back again. Physiotherapy will take some time, but will not cure the roots. It's just temporary. So I said, you know, if that's the case, I will take the surgeries. I did a keyhole operation. So about 1.5 hours, the whole procedure is over. After that, I go for my rehab. Now I'm doing a lot of exercise, the glute, you know, muscle behind. So you do squatting, then you do some leg raise, you do some bridge, you know, bridge when you lie down, then you do a bridge. Then you do some side walk. But really, you feel the muscles, you know, working. The first 2 weeks, I just make sure I'm careful first 2 weeks, you know, because I feel that it's still very raw. Then after about 2 weeks later, the doctor want me to put on the guard, you know, a waist guard, in case, you know, I over-jerk myself. Precaution actually is, you know what, whatever you do, you walk, you don't walk too fast. Don't run, because once you fall, then you have to be careful. The most happier thing is that, you know, I've been back to normal again. You know, I can do my activities, I can go for my trekking, I can go for my daily walk, you know, so I can go back to gym a little bit, yes.
Ooh.
Hey, a success story. All right.
Okay, heartening,
Yes,
because
it is.
Frankie's story is kind of reflecting mine.
He talked about how, you know, he worked as a chef, and I think he wasn't quite sure whether it was the long hours on his feet that caused it.
Yeah.
What was his
Yeah,
cause?
I think he described it perfectly, actually, because it was a combination of factors. First, like he mentioned, is the age-related degeneration in the spine, which is inevitable. Because of his work as a chef, he's obviously got very long hours, probably carrying a lot of heavy things, and probably he has chronic poor posture due to the nature of his work.
What about people who are seated all day at work, you know, the 8 hours a day just sitting in front of a computer? Is that bad, or is that okay?
No, that's not good also. Okay. So, I mean, we've got the 2 extremes. We've got people with very heavy physical work, and they're also prone to getting these kinds of problems, again, because of heavy lifting, poor posture, not having good techniques for lifting and carrying over a long period of time. And then on the other hand, we have people who are more sedentary with desk-bound work, and then you end up with chronic posture problems, maybe the ergonomics of the desk, the chair, the eye line, everything is not right. And then over time, this definitely can predispose to these problems also.
Oh
Doctor, I have a question though. Are there any specific medical conditions that would, lead to sciatica, or is it just like you mentioned, just bad posture?
So if you look at things like, say, slip discs, there are some medical conditions that would have a higher incidence. So things like people who have diabetes, people who are carrying maybe excess weight, people have maybe smokers, they have a higher risk of these issues. And then also there can be some genetic factors. So there's some patients, there's quite a strong history in the family of back problems that can occur at younger ages. And then on the other hand, sometimes we don't find any obvious kind of triggers or any obvious reason as to why people end up with a slip disc. And sometimes people just bend down to pick up a tissue and suddenly pop.
Bang.
They're back. Yeah.
Yeah, like, you know, for him, he didn't know whether it was the activities or not, but more than likely it was probably the degeneration.
I think it was a job too, because I used to be a chef and I would have massive back pain, and when I stopped, it went away.
Right. So, but then you also may not be able to help it if it's just degeneration. You can't stop it from happening, right?
Yeah. So, I mean, what we advise people, if they already have some symptoms, on top of the measures we mentioned just now, we do recommend usually that people go for physiotherapy because that can address a number of things. So first of all, it can help to build up the back and core strength, which is important. And then also it can help to address any posture issues. And then they will also focus on the mobility of the spine and then getting people back to their normal activities. And for instance, people who want to get back to exercise or to the gym, the physiotherapist can sort of supervise the program, and they can ensure that people, say if they want to go back to the gym, that when they're exercising that they don't put strain on their back and that they pay a lot more focus on the form of the exercise and not the actual weight.
Absolutely. So one of the things that the doctor said was to strengthen your core, right? So we go to the gym and then, you know, we get a trainer and we say, hey, I need to strengthen my core. They get you to do deadlifts or they get you to do, you know, these weights that would make your pain worse. And then when you tell them, they really don't understand, they don't get it, that your motion is so limited that you cannot do it. But I have to do it to strengthen the core. So it's like very chicken and egg, you know?
So what is yours? You got that diagnosed
so
when
mine
you were
is
how old?
degenerated discs. So that was my first diagnosis, and that was at 16. So it was really bad, and the cartilage in between was like gone. Because I used to dance and I used to swim a lot. So
that's why you had to do your O-level exams standing up.
Yes.
That's insane. Is there a name for...
Mine is degenerated discs and then this bulge.
Right,
Yeah, so because of the disc bulge, where the disc moves and then it presses on the nerve. Right, doctor?
Yes.
So what did you do to treat it?
They did offer me surgery, and at that point, the doctor said there was a 50-50% chance.
When you were 16?
Yes, of paralysis, and my mom was like, no.
Has the technology gotten better since then?
Certainly, these days, the risk of paralysis from surgery is very low. So for a slip disc, for instance, usually I quote my patients 1 in several thousand risk of being paralyzed after surgery. So thankfully, it's quite rare. The important thing is that we have good selection, that there's a correlation between the symptoms and what we see on the MRI scan, and then we can be confident in the success of the surgery if surgery is necessary.
So can I jump in there real quick just to say that it was a little bit heartening for me to watch Mr. Frankie's situation, because he mentioned not slice me open and, you know, do some major thing. He talked about keyhole. So that was surprising to me. I didn't know that was an option, you see.
Yeah, so most of the time we can do keyhole surgery these days. So it's called minimally invasive spine surgery. And the advantage of that is it's less invasive. Surgery has lower risk of complications, and the recovery from surgery is faster. So we can usually offer minimally invasive surgery for a large number of our patients these days.
Is it straight to surgery if medication doesn't work?
Oh, no, not at all. So we will always start off with conservative treatment, unless the symptoms are very severe, where you have weakness or incontinence. So as long as the symptoms are not too severe, we will generally try to manage with medication and physiotherapy. Some patients will go for other forms of therapy, like TCM treatment, acupuncture, maybe osteopath, chiropractor treatment. Some people...
This is like just saying...
Frankie said that, what was it, a couple weeks for him before he started feeling comfortable to get back into workout mode. Is that the recovery, just a couple weeks?
So for his condition, he had the spinal stenosis. So once we were able to shave away the bone spurs and the excess ligament that was pressing on his nerves, actually within a few weeks, the recovery is already there. So people can pretty much get back to their normal activities. It's a little bit different for slip disc, because what you don't want to happen is a recurrence. So you don't want to do a surgery and then, say, 6 weeks after surgery, the same thing happens again. So we have to be a little bit more cautious with slip disc. So we generally let people recover a little bit slower. But generally within 4 to 6 weeks, patients will restart their physiotherapy. And then within 2 to 3 months, they will usually be back to their normal activities.
Thinking maybe for a situation like mine, the spondylolisthesis, it might be a bit more complicated because it's the slippage of the actual vertebrae, right?
Yeah, so for that one, usually we will have to put in implants because normally we will have to put some screws into the L4 bone and the L5 bone and then bring the bone back into line.
But that sounds good. It sounds to me like that sounds good. Like, get it fixed.
Yeah.
Mike, Kasem.
If you could take the surgery in my place and I could be pain-free from your surgery, I would sign up.
All right, guys, it is time for a break. We're going to be back to talk about prevention, plus a pop quiz for our guests on Everybody Knows.
Welcome back to Everybody Knows, and it's time to talk about the prevention of sciatica. Dr. Colum, are there some things that we can do to minimize the risk of sciatica?
Yes, definitely. For instance, if we have diabetes, we can get it under control. If we smoke, we can try and stop smoking. If we're overweight, we can try to shed some pounds. Of course, that can be a vicious circle for people with sciatica because when you have pain, you can't exercise. But in terms of prevention, that's certainly important. And then in terms of our work, for instance, desk work, we can certainly modify our setup. Sometimes people will actually use standing desks, so that's something that can be quite useful. But we always encourage people to be as active and healthy in general as possible.
You know, I only ever see Denise standing while she's on air.
Yeah.
Right? She never ever sits, ever.
So for most people, sitting actually makes their condition worse, particularly if they're sitting on soft chairs or they're in low seats.
This is why it's so important to just be careful with your body, to not abuse it, not overuse it, and prevent it from ever happening. Because when it happens, you realize you actually have to do a lot of things sitting down.
You know what? To test whether all of us have been listening, we're going to play a bit of a game. True or false?
Right.
Question number 1.
Anyone can get sciatica. True or false? So yes, it's true.
Anyone, absolutely anyone can get it, unfortunately.
All right, next question.
If you have leg pain, it always means that it's sciatica.
Always means that.
For them, it does.
So yes, false is the correct answer.
False is correct. Next question.
So question 3, sciatica is a symptom, not a disease.
Ooh, no, it's a disease. True.
All right, so that's true.
Next question.
Sciatica sufferers should stay in bed until the pain goes away.
It really depends. Like for me, if I just lay in bed all day, the pain just relieves itself, and then I'm like, okay, thank God.
Like I said, my motto is motion is lotion. Move so that the pain will eventually alleviate. So I'm going to say false.
So we know the answer is false. Last question. Sciatica is always caused by a herniated disc.
No.
Always caused by... No, you guys have different types of sciatica, right?
Yes.
Different
So
causes.
false.
Yours is what?
Okay.
Scandalous.
Spondylolisthesis.
Spondylolisthesis. All right,
You guys
we
sound
got
like a boy band. Guys, thank you so much for watching, and thank you, Dr. Colum, for
very
your
much.
wealth of information, answering all our questions on sciatica.
If you've been having sciatica, it might be time to consult a doctor.
And a big thanks to our special guests, Denise and Sajini. It's been great having you guys on the show. I mean, really,
Thank you for
we could
having
not
us.
have had more perfect guests. The exact problem.
Thank you for rearranging your entire set for us.
Standing with us. Thank you for standing with us.
You're welcome.
You got it. We will catch you guys next time on
Everybody knows.
Thanks, Doc.
Thanks very much.
Appreciate it.